Today we're going to talk about the structures of the respiratory system. Looking at the upper respiratory system in objective number 1, looking at starting with the nasal cavity, the internal nares are basically the nostrils. They're the external opening into the nasal cavity. So this large region here with these folds of tissue, this is the nasal cavity. And what divides the nasal cavity from the oral cavity below is the hard and soft palate. So here is the hard palate. Whoops. So this is the hard palate. You can see it's made of bone. And then beyond that is the soft palate. And if you run your tongue on the roof of your mouth, you can feel how the hard palate transitions into the soft palate. And the very end of the soft palate is this little flap of tissue that hangs down in the back of our throat. Looks like a punching bag back there. That's the uvula. So this structure right here is the uvula, and it's the end of the soft palate. And that helps to protect our nasopharynx when we swallow food. When food comes down into the mouth, it goes down into the pharynx. The uvula will push against the back side and protect anything from going into the nasal cavity. So the throat is called the pharynx. It's a common passageway for both air and food. The top of the throat, this region of the pharynx that goes from the back of the nasal cavity here at the roof down to the tip of the uvula, this is called the nasopharynx. So this region from here to here is the nasopharynx. What we find in the nasopharynx, up in the roof of the nasopharynx, is a cluster of cells that make up the lymph nodes, one of the lymph nodes, and this is the adenoids. Another name for them are the pharyngeal tonsils. So they're up here in the roof of the nasal pharynx. The oral pharynx is just behind the oral cavity. So here we see the oral cavity, and this is the tongue here. So just behind that is the oral pharynx. So from the tip of the uvula to the tip of the epiglottis, this region right here is the oral pharynx. And what we find on the lateral walls of the oral pharynx are a pair of tonsils called the palatine tonsils. So we can see that here on one side here of this cross section, or the sagittal view. These are the palatine tonsils. So on the side. Palatine tonsils. And then beyond that, the pharynx continues down to where the two passageways divide. Food continues down the esophagus, and air will be directed toward the larynx and the trachea. So from the tip of the epiglottis, which is this fold of cartilage here that will cover the trachea when we swallow, this epiglottis, from the tip of the epiglottis to where this pharynx divides into two passageways, this is called the laryngopharynx. So from here to here is the laryngopharynx. Looking at the larynx then, when you get down to this near the dividing area of the pharynx where the trachea carries air and the esophagus carries food, we have the larynx, otherwise known as the voice box. So if we look here, this is the larynx. It's at the top of the trachea right here. So this is the first part of our airway. At the bottom of the pharynx is the is the larynx with the trachea below. So at the top of the larynx is a horseshoe-shaped bone called the hyoid bone, and the muscles of the tongue and ligaments of the tongue attach to this, and allows us to change the shape of the larynx to change our pitch of our voice. And the larynx is this whole structure here. It's made up of several sheets or plates of cartilage. We won't go into the details of that structure, but just know that the whole structure here is called the larynx. And then the vocal cords are folds of tissue, ligaments that we see that stretch across the airway here that produce sound when we exhale past our vocal cord. So here is a vocal cord. And again, the epiglottis is this flap of cartilage that covers the larynx when we swallow. Here's another view of the epiglottis from a front view. It kind of looks like a tongue poking out here, but it's actually a flap of cartilage, and it actually has taste buds on it that we can detect taste down at the top of our larynx. The next slide shows a view looking down into the airways. So this is the larynx here. It kind of looks like a mouth, but this is the larynx, and the white structures are the vocal cords or the vocal folds, and the glottis is the space between the vocal cords. So this space between the vocal cords is the glottis. Now, when we close the vocal cords and we close the glottis, that allows us to bear down to increase abdominal pressure, which happens reflexively when one has a bowel movement or when a female is delivering a child through the birth canal. Then we get to the region of the lungs. So here we see the lungs and the diaphragm, the sheet of muscle that the lungs rest on. So we look at one lung here, we can see it has kind of a triangular shape. The top pointed portion of the lung is called the apex. The wider lower bottom region of the lung is called the base. The hilum is the internal medial aspect of the lung where the airways and the blood vessels enter and leave the lung. So right here would be the hilum on either side. If we look at it here, right here, we can see the hilum here and the hilum here is that region where the airways and the blood vessels enter. The lung is divided into 3 lobes on the right-hand side, so we can see these deep fissures that partition the lung into 3 different major sections. We call those lobes. And there's 2 lobes on the left-hand side. We can see that the lung is kind of notched out on the left-hand side, and this is where the heart would be found. Again, the sheet of skeletal muscle that the lungs sit on here is the diaphragm. So if we look at the airways as they lead into the lung, just below the larynx is the trachea. So this has C-ringed cartilage around it, just in the front and sides, but not in the back, because that's where the esophagus is located, and we wouldn't want cartilage all the way around. That would prevent the esophagus from swelling with a bolus of food traveling down it, and we would need some flexibility in the back of the trachea to allow food to pass down the esophagus behind. So we have the trachea, and at the bottom of the trachea, right, this last cartilage piece here, is a special structure called the carina. And the carina is a flap of cartilage that extends into the trachea, and it has a great number of sensory receptors on it. So if we get liquid or food down our airway, down into this carina, it initiates a violent coughing response. And if this has ever happened to you where we say the food went down the wrong pipe or you swallowed the wrong way, you've experienced that violent coughing reflex. And that's the body's way of protecting anything that is not meant for the lungs from getting into the lungs. So any liquid or solid material is prevented from entering the lungs by having this violent coughing reflex with the carina. Then this trachea branches. The first branching is called the primary bronchus. So we can see there's 2 primary bronchi, one serving each lung. Then those bronchi, those primary bronchi, divide, and we can see that each one serves a lobe of the lung. So the next division of these bronchi are called the secondary bronchi, each serving one lobe of the lung. So we can see here on the left side that there are only 2 divisions of the primary bronchi because they're primary bronchus, because there's only 2 lobes of the lung. Here we can see there's 3 major divisions, one here, and one here. So these are the secondary bronchi that serve each lobe. Then those secondary bronchi will branch again into smaller bronchi that serve each bronchopulmonary segment. So the lung is further divided into small sections called bronchopulmonary segments. And that's not shown in this diagram, but we can look at it here in the diagram of the trachea. We can see the different divisions of the trachea. We can see the primary bronchi, and then we have the secondary bronchi, and then lastly the tertiary bronchi. So these bronchi will branch 23 more times before we get to the smallest of airways, which are called the bronchioles. Here we can see a bronchiole. It has smooth muscle around it. No cartilage when we get to these final bronchioles. It's only smooth muscle that keeps them open. So when we constrict smooth muscle, like with an asthma attack or some type of irritant in the environment, or maybe even intense exercise, people get the symptoms of asthma. So they're going to inhale a medication that's going to relax the smooth muscle around the bronchioles to allow them to breathe more easily. So this is the bronchiole. Then these bronchioles branch final branching of the bronchiole is the alveolar duct. Here we can see there's no smooth muscle. It's just simple squamous epithelium, one layer of thin cells. This is the alveolar duct. So this alveolar duct is this portion right here, and then it has little outpouchings, small air sacs called alveoli. And the alveoli, if we use it in a singular term, it's called an alveolus. These are where gas exchange takes place. So the job of the airways is just to deliver that oxygenated air to the alveoli, and it's in the alveoli where the exchange from the lungs to the blood takes place. Because if you look in this diagram here, we can see this network of blood vessels that wraps around the alveoli. Those are the capillaries that receive the oxygenated air and send that to the rest of the body. So that concludes our discussion of the anatomy of the respiratory system.